Hi, everybody. We are going to go ahead and get started. So welcome to the webinar. I'm Molly Robb, the project coordinator for the California Evidence-Based Clearinghouse for Child Welfare, or CEBC for short. I'd like to thank you all for joining us and welcome you to the webinar. We've muted your phones due to the high number of participants attending, so if you're experiencing any technical difficulties or have any urgent questions, please use the Q&A pod located at the bottom of the screen and we will do our best to assist you. We will also answer questions after the completion of the webinar. Please also find the PDFs of the webinar PowerPoint slides in the bottom left corner of the screen in front of you. Lastly, you will receive an email with a link shortly after the conclusion of this webinar to complete a short and easy survey so we can continue to improve our webinars and make them as useful and beneficial as possible in the future. Now, a brief introduction of our presenter. Jared Martin is a research associate with the Chadwick Center for Children and Families at Rady Children's Hospital, San Diego. Jared's primary role is to support the CEBC's work on promoting guidance and resources on the implementation of evidence-based practices, which includes conducting trainings and webinars on implementation topics, providing technical assistance, and keeping the CEBC selection and implementation website up to date with research and new content. And now I will go ahead and turn it over to Jared.
All right. Well, thank you, Molly, and hello, everyone. So before we start, I did want to let everyone know that if you're experiencing any tech issues, that you can contact Molly, and her email address is up on the screen. So that's mrob@rchsd.org. Okay, so before I begin, I did have a caveat on the topic of this webinar. And so the webinar is called Reducing the Use of Psychotropic Medications Through Increased Use of Evidence-Based Practices for Children and Youth in Foster Care. So the purpose of this webinar is to provide information to agencies on how to strengthen and expand their available mental health care, specifically through the use of evidence-based psychosocial interventions. So that being said, I'm not going to be going into any type of medical recommendations on the use of psychotropic medications. So that includes information on dosages for weaning off of medications, side effects, drug-drug interactions. So if you are looking for information in that area, you'll want to consult a medical or psychiatric practitioner. Okay, so what will I be talking about? And so I have the learning objectives detailed on the slide. And so first, we're going to be talking about the rationale for the use of evidence-based psychosocial interventions prior to or in place of psychotropic medications in most cases. Now, we do recognize that medications may be needed in some cases. However, the webinar will not be covering that topic. And secondly, we're going to be going into how to properly identify and select an evidence-based practice that addresses the behavioral and mental health needs of children and youth in your community. Then lastly, we're going to be talking about how to effectively prepare for the implementation of evidence-based practices in your community, and that includes addressing potential barriers and challenges. Okay, so just again, just to be clear, not going into any medical recommendations on the use of medications. So we did want to have a disclosure slide just to let everyone know that there is no conflicts of interest, and then also a really important point, which is that the CEBC does not endorse any psychosocial interventions featured on our website or in this webinar, which I will be showing some of our website. And so really the tool that we have through our website is for educational purposes only. So that being said, the goal of this webinar is to provide everyone with the knowledge and the tools on how to address the issues that are unique to your own community. So while I will be detailing information that is practical, unfortunately there is no one-size-fits-all approach to implementing evidence-based practices, particularly in child welfare settings where there's a great deal of diversity. So hopefully once we're done, you'll be able to take this information back to your agency and apply it to address your own unique needs. All right, so I did want to start out by having a poll question. And so we wanted to get a sense of what are the different types of positions that are on the webinar. So you can see that we have A, direct service, B, supervisor manager, C, administrative support, and D, director or agency leader, and E for other. I know we have some academia folks and some other fields as well on the webinar. So I'm going to have Molly go ahead and open up that webinar, and if you can just select the position that best reflects what you do. I'm going to go ahead and give a couple seconds for everyone to answer. All right, we're going to go ahead and end the poll now. And we're going to broadcast the results so that we can show everyone. It looks like the majority of folks on the webinar are other, but that's okay. So we do have the next direct service is the number 2, and then we have supervisor managers, and followed by directors, and then administrative support. So the reason why I'm asking this question is because the information that we're going to be talking about in the webinar is ideally for folks who are in organizations that are addressing this issue and have the capacity to make decisions. So that's not to say that direct service providers or folks that are in academia or in a government agency won't benefit from what we're going to be talking about today. But in terms of reducing psychotropic medication use through evidence-based practices, what we're going to be talking about is very organizational based and strategies for how to implement EBPs. So we're going to go ahead and close that. I can figure out how to close that. All right, there we go. Okay, just starting out with some basic terms. So there really is no universal definition for psychotropic medications. For the purpose of this webinar, we're going to define them as those that act in the brain to reduce symptoms of mood, cognition, or behavior. And so psychotropic medications work by mimicking, enhancing, or decreasing the action of neurotransmitters in the brain. In contrast, psychosocial interventions address psychological and environmental contributors. And so those are a wide variety of services and supports and strategies that aim to change behavior and support individuals with behavioral and mental health challenges. So these are services which are provided within a community setting. And these types of services provide a range of non-medical interventions, including assessment, counseling, case management, coordination of care, group work, information, community education, and also professional consultation to other service providers as well. So I did want to detail just some examples of targeted symptoms for medication. I'm not going to go into a lot of depth on this, but just this information does play out in terms of when we talk about selecting a psychosocial intervention, so I just want to touch on this. So starting out with stimulants, we know that they can target hyperactivity, impulsivity, inattention, and aggression. Antidepressants and mood stabilizers can target depression, anxiety, rage outbursts, manic episodes. And then we have also anti-anxiety and anti-panic medications, which can target excessive worry and fear, feelings of impending doom, tension, rapid breathing, and heartbeat, even without the presence of any real threat. And then there's antipsychotics, which target hallucinations, delusions, cognitive disorganization. And then finally, we have sleep medications, which can target severe insomnia. And so while many of these medications are effective at decreasing symptoms, there is great concern about their short-term and long-term impact on child well-being. So for example, side effects of antipsychotics include irreversible movement disorders, seizures, diabetes, high cholesterol, kidney and liver damage, and metabolic disruption resulting in rapid weight gain. So given the severity of these side effects, prescriptions for antipsychotics have been placed under great scrutiny. So while they are approved as first-line treatments for schizophrenia, bipolar, and severe behavior problems associated with autism, they are also used off-label to treat disruptive behaviors in children without those diagnoses. It's also important to note that many psychotropic medications are not specifically approved by the FDA, which is the Food Drug Administration, for the use among children and youth under the age of 18. So if you want more information on the different classes of medications, you can visit the link that's provided on that site, which is to the American Academy of Child and Adolescent Psychiatry. All right, so we know that children in the child welfare system are given psychotropic medications at much higher rates than children and youth from the general population. So the rates range between 2.7 to 4.5 times higher than youth and children from the general population, and that comes from the Government Accountability Office in 2011. And research has also looked at Medicaid data from 2008 from 5 different states and found that 21 to 39% of children in foster care have received a prescription for psychotropic medications, and that's compared to 5 to 10% of children not in foster care. In addition, rates of polypharmacy, which is children who take more than one psychotropic medication at once, range between 3 to 11 times higher than children not involved in child welfare. So Medicaid data shows among foster youth prescribed psychotropics, 72% are receiving medications from 2 or more classes. So the rates are very high. But there is some good news. Rates of psychotropic medication use among children and youth in the California foster care system have been steadily declining. And so this data comes from the most recent reporting from the Child Welfare Indicators Project, which, if you're not familiar, provides state and county level data in California on psychotropic medication use and also specifically on antipsychotic use as well. And so you can see on the slide in California, the most recent reporting, it was 11.8% of children in the foster care system are on psychotropic medications. All right, so why are children and youth in foster care taking these types of medications? So when we look at their mental health needs, we need to first talk about the impact of trauma. So as many of you know, traumatic experiences are highly prevalent for those coming into the foster care system, and that trauma can lead to very diverse and very complex mental and behavioral health issues. So it is important to note that symptoms of trauma can often appear to be a mental health disorder like ADHD, anxiety, bipolar, or oppositional defiance. So for example, if a child or youth who receives a diagnosis of ADHD and has a history of trauma, it is important that there is proper screening and assessment to ensure that the diagnosis of ADHD is correct. And we're actually going to be talking about this in a little bit more detail because this has important implications for implementing psychosocial interventions. So this will come up later. And so you can see rates of mental health disorders among foster care compared to the general population range between, or actually are 49% versus 13.4%. That comes from a recent meta-analysis that was conducted this year, or published this year, I should say. And then the common diagnoses for children in foster care include attention deficit hyperactivity disorder, and from that same meta-analysis, they found that the rates range between 2 to 21%. Anxiety disorders, which include generalized anxiety, over-anxious disorder, separation anxiety, specific phobia, social phobia, panic disorder, obsessive-compulsive, and post-traumatic stress, and other disorders not otherwise specified. Those rates range between 4% to 32%. Disruptive behaviors, which is a category that includes conduct disorder and oppositional defiance disorder, that ranges between 15% to 39%. And then finally we have mood disorders, which includes major depression disorder, bipolar disorder, and dysthymia, and that ranges between 3 to 38%. Okay, so the high frequency of psychotropic medication use in foster care has raised concerns about whether these rates are clinically warranted or therapeutically beneficial. So legislation has been passed that has helped to bring more oversight to psychotropic medication use in foster care and to better meet the needs of mental health needs of children and youth. So you can see first the Fostering Connections to Success in Increasing Adoptions Act that was passed in 2008, and that brought more oversight and coordination of mental health services. And then in 2011, Congress passed the Child and Family Services Improvement and Innovation Act. And this act requires states to include protocols on psychotropic medication oversight. And then finally, the Because Mind Matters Summit, which was sponsored by ACF and SAMHSA and the Centers for Medicare and Medicaid Services, that occurred in August 2012. And that's where state leaders within child welfare, Medicaid, and mental health work together to create steps for enhancing oversight and monitoring psychotropic medication use within foster care. So there is a great deal of variability in child welfare agencies in terms of how they've responded to bringing improved oversight to psychotropic medications. So there are government agencies and professional associations who have detailed their own guidelines and recommendations to help provider agencies effectively and appropriately address mental health issues. So I just wanted to highlight a few. The first is the California Department of Social Services and the Department of Healthcare Services have guidelines, which is a statement of best practices for the treatment of children and youth in out-of-home care. And that includes basic principles on treatments and informed consent, also expectations on the development and monitoring of treatment plans, and also principles for governing medication safety. And then we have the American Academy of Child and Adolescent Psychiatry in 2015 released recommendations on the use of psychotropic medications for children and adolescents involved in child serving systems. And so their recommendations are broken down into three categories, and that includes clinical practice, medication oversight and monitoring, and research. And then lastly, I wanted to highlight a recent webinar that occurred from the American Youth Policy Forum on how research evidence informs foster youth medication policies. And that featured a panel of speakers, one of whom was Dr. Laurel Leslie, who is also on the CEBC scientific panel. And that webinar is recorded. You can access that and watch it for free. And that webinar highlights research on policy and how states can improve oversight. And it also includes a very thorough example from the state of New Jersey as well. And briefly, I wanted to highlight some additional resources to better inform caregivers, caseworkers, and youth about psychotropic medication use as well. So CVSS and HCS have released the questions to ask about medications for both caregivers and for youth. And it's really to help guide conversations with the medication prescriber, the pharmacist, social workers, judges, and attorneys. And then there's also the Mental Health Bill of Rights for foster youth. And that's a resource for youth to educate them on their rights related to mental health care, and that it also includes psychotropic medication use. And then finally, there's the Supporting Youth in Foster Care in Making Healthy Choices. And those are educational resources on mental health, trauma, and psychotropic medication use. And there are two versions, one for caregivers and caseworkers, and then one for youth in foster care. And those are put out by the Children's Bureau. Okay, so many of these guidelines highlight the need for agencies to utilize psychosocial interventions, so prior to or in place of psychotropic medications. So why? Why are agencies, why should they emphasize psychosocial interventions over medications? So while reducing medication usage is an important goal, by simply reducing psychotropic medication use without providing an effective alternative, that can lead to problems by failing to address the primary mental or behavioral health issue. In fact, the limited availability of alternatives is what providers often cite as one of the driving reasons for psychotropic medication use in the first place. And so there are psychosocial interventions that can safely address the same mental health issues that originally led to the need for medications in the first place. So these interventions are vital, as the psychosocial functioning of children and youth in foster care may affect not only their long-term functioning outcomes, but also the decision to continue or exit them from foster care. So for example, children with poorly treated mental health disorders may be less likely to be reunified or adopted. So, how do you choose the right intervention? Well, there just happens to be this great resource called the California Evidence-Based Clearinghouse for Child Welfare. And so for those of you that aren't familiar with the CEBC, we are funded by the California Department of Social Services, specifically the Office of Child Abuse Prevention. And we're operated by the Chadwick Center for Children and Families at Rady Children's Hospital in San Diego. And our mission is to advance the effective implementation of evidence-based practices for children and families involved with the child welfare system. So for those of you that haven't been to our website, this is a screen cap of what the homepage looks like. In a little bit, I will go live and kind of do a very brief walkthrough of our program registry. But you can get to our website, and the address is up top at cbc4cw.org. And then you can see the program registry can be accessible through the left-hand button where it says View Programs. And then the right-hand button where it says Select and Implement Programs. That's a relatively newer section. We launched that, I want to say, about a year ago. And so a lot of our implementation work, selection and implementation work that we're going to be talking about in this webinar can be accessed in that part of our website. And there's tons of resources, lots of tools, also links to educational information in terms of if you want to learn more about effective implementation. So like I said, this webinar is going to be highlighting some of that information in there. All right, so being that we have a pretty large crowd on the webinar, I think it's pretty safe to assume that not everyone's going to have the same level of familiarity or experience with evidence-based practices. So I wanted to have a poll question that would kind of give me a sense of how much depth I should go into in terms of when I introduce psychosocial interventions. So you can see your first option is A, extensive, that you've been running one or more EBPs for over a year. B, moderate, you started up an EBP within the last 12 months. And then C, slight, you are preparing to implement an EBP. And then D, no experience, but you're currently learning about EBPs and may consider adopting one. And then lastly, E, not applicable, or if you're unsure. So I'm going to go ahead and have Molly open up that poll question and give everyone a couple seconds to respond. Okay, looks like folks are still answering. Okay, we're going to go ahead and close it now. And then broadcast it so that everyone can see it. Okay, so sorry if you didn't get a chance to, it closed. We're going to go and open that back up. All right, so looks like majority of you are, it's not applicable or you're unsure, and that's okay. And then looks like, well, actually, it looks like the number one response was extensive. So you've been running one or more EBPs for over a year, and that's great. And then we have quite a few people underneath that as well. But okay, so I probably won't go into too much depth. I'll just touch on the basics in terms of how the CBC defines EBPs so that we're pretty clear. So let's go ahead and minimize that. Great. Okay, so very basic information in terms of what are evidence-based practices. So when we talk about them, what we mean by that is that they're rigorously tested interventions or prevention programs found to be effective. And so these typically come with a manual or training, or at least what the CBC features on our program registry. It needs to have some method to be replicated. So if you're an agency in a particular county that's either rural or what have you, and you're interested in bringing this new program to your area, there's someone that you can contact for training, or that there's a manual that someone can provide you so that you can replicate that in your area. And then a very important aspect is that they need to be implemented with high fidelity. So these are practices that are found to be effective in research, and in order to achieve those same results found in the research, they need to be administered in a similar method, so with fidelity, in order to achieve those same results. And so if you're interested in learning more about evidence-based practices in terms of kind of what makes an EBP, and what is some of the history and common misconceptions, you can access that under link on the slide there, which is to our Understanding Evidence-Based Practices section as well. Okay, so this is important information. I'm not going to go into a lot of depth, but what amount of research makes a program evidence-based? So I'm going to briefly touch on our scientific rating scale, because this information plays an important role during your selection process and what you need to consider. So I'm not going to spend a lot of time, but if you're interested in learning more, you can go to the CBC website to access resources, and then we also have recorded webinars on this topic as well that go into a lot more depth. But the main point of the slide is to emphasize that just because a psychosocial intervention is listed on the CBC does not mean that it is evidence-based. There are varying levels of supporting research evidence. Each program we review is rated on a scale of 1 to 5, and that's where we carefully review all peer-reviewed literature to determine the rating. So the basics of the scale that you should know are, ones are well supported by research evidence, which means that the program has at least 2 randomized controlled trials with a follow-up of 1 year that shows a sustained positive effect. A 2 is supported by research evidence, and that has at least 1 randomized controlled trial with a 6-month follow-up that shows a sustained effect. 3s are promising research evidence that show positive findings when compared to another group, so a control group. And then 4s and 5s are practices with research that show concerning results. So either the program fails to demonstrate effect, or the effect is concerning in that there are negative outcomes. And then lastly, NR means not able to be rated on the CBC scientific rating scale, which means that the intervention either does not have any research, or it has research, but that research is not able to be rated on our scale. So we include NRs in our program registry so that if an agency hears about a certain practice that is being marketed, then they can go to the CBC to determine if the program actually has any research evidence supporting its effectiveness. So the last point that I want to go over is that the CBC does not currently rate interventions that include psychotropic medications. However, since there are mental health issues that research shows is best treated with the combination of psychosocial intervention plus medications, we are currently discussing ways to approach the inclusion of such programs on the CAPC. Okay, so going back to that question about how do you select the right psychosocial intervention. So some of you may be familiar with a field of research called implementation science. So the CBC uses an implementation framework called the EBPs framework in all our training and technical assistance. So there are other CBC webinars where we go into a lot more depth on the EBPs framework and how agencies can use this framework to strengthen their implementation efforts. But for this webinar, I'll just be touching on some of that material. For those not familiar with EBPs, I do want to briefly cover what those phases include. So starting with exploration, you can see on your slide that an agency has identified a problem and starts to look for new programs as a potential solution. And then once they've made the decision to adopt a specific intervention, they move to preparation. And that's when they start to recruit and train new staff and gather resources needed to run the program. And then once the agency actually starts offering the intervention to the target population, then it enters the implementation stage. And this is when the agency is monitoring fidelity and outcomes and providing coaching to the clinicians in the organization. And then lastly, sustainment. The agency is continuing to monitor fidelity and outcomes, and also organizational issues like funding issues and staff turnover as well. And so part of this process is going back to the other stages in order to address issues related to sustainability. So they can go back to the implementation stage to access more coaching, the preparation stage to secure more resources, or all the way back to exploration in that the intervention possibly doesn't work and you need to kind of start from scratch again and look at what else is out there. So this is the EBPs phase model or framework in a nutshell. And so the CBC website includes extensive resources on all these phases. However, I'm only going to be covering the exploration phase and some of the preparation phase in today's webinar. So starting with forming an implementation team. So this is the first step. And you really want to have a dedicated group of individuals who oversee your efforts. And so these would be individuals driving your efforts to strengthen your mental health services in order to decrease psychotropic medication use. And again, you can learn more details about forming implementation teams by watching our recorded webinars. But only the key point that I want to cover here is that you want to make sure that the people that you have on your implementation team have experience and knowledge in the issues, and that you are, and that has people who can actually make decisions in the organization so that the actual progress can be made. So be it someone at the senior level, administration level, a manager, and then also you want to include content experts, parents or youth, and then others deemed appropriate throughout the process. And then the next step would be for your team to engage in a needs assessment. So this is important because every psychosocial intervention is different, and you want to make sure that you adopt one that actually targets the root cause of the issue that is driving psychotropic medication use in your community. So I'll demonstrate an example in about 2 slides. But in a way, we've actually already conducted a needs assessment in the beginning of this webinar when I talked about the issues of high psychotropic medication use and the mental health needs of children and youth in foster care. However, you'll want to look at your own local data to find out what the actual diagnoses and other important target population data. So first, you'll want to look at the data that you already have, like existing mental health data, annual reports, system improvement plans, efforts to outcomes, first 5 data, referral data, chart reviews, and possibly data available from the Child Welfare Indicators Project. So it may be possible that your agency might not have access to all these types of data, so it may be necessary to call in individuals from other agencies like mental health to pull this data for you. So in some cases, you may also need to gather new types of data, so possibly through surveys or focus groups in order to fully understand the issue. And then lastly, as your implementation team is conducting its needs assessment, they may uncover other concerning issues. So it's important that your team focus only on one issue at a time so that their efforts do not get sidetracked or delayed. All right, so there is other important information that you'll want to make sure you factor in your needs assessment to ensure that you're effectively meeting the mental health needs of your children and youth. So the first is knowing what already exists in your community. So it might be possible that your community already has a psychosocial intervention that addresses the primary mental health issues your children and youth are experiencing. So who are these interventions specifically for? If you're already using them, are they working? And what are the challenges using those interventions? So for example, if you're in a rural community and the service is in a more distant area, transportation could be a very challenging issue in terms of getting your youth to be able to access that service. Your implementation team will also want to examine your current screening and assessment protocol to ensure that the diagnoses that children and youth are receiving are accurate. So as you'll recall, we talked about the impact of trauma and how it can lead to diverse and complex symptoms that may appear to be mental health diagnoses like ADHD, anxiety, mood disorders, or disruptive behavior disorders. And then lastly, if you have available psychosocial interventions already in your community, how are your current referral systems working? Who makes referrals in your agency? Does the person who makes the referral receive the assessment information in a timely manner to ensure that the youth or child receives services quickly? So this is all important information that will guide whether or not your agency needs to adopt a new program in the first place. Okay, so this is an example that I wanted to demonstrate in terms of conducting a needs assessment. So one way to approach a needs assessment is to ask why 5 times. And you might also be familiar with this process is referred to as a root cause analysis. So starting at the top, we can see you want to start with a question. And so our question is, why are youth prescribed psychotropic medications? And the answer is to address challenging behavioral mental health issues. And you want to ask why again. So in this example, the organization identified that they're referred to a psychiatrist at the recommendation of a therapist and or a social worker. So again, you want to ask why. So many of these youth have already received or are currently receiving mental health services. Again, you want to ask why. So youth have ongoing histories of behavior problems and conflict over rules and expectations as well. And again, why? So externalizing behavior disorder is the most common diagnostic group. So you can see that through this process, by asking why 5 times, the organization was able to drill down to the diagnostic group. So this finding will guide the implementation team when it comes to identifying potential solutions to addressing externalizing behaviors. So before we get into psychosocial interventions, it's important to note that adopting a new program isn't always necessary in order to address the issue. So one of the reasons why the CBC highlights kind of looking at internal processes first is that a program doesn't necessarily need to be adopted in every situation. So the first is an agency may only need to make a change to an internal process, such as making referral processes more efficient, in order to access available psychosocial interventions that already exist in your community. So another option could be that your agency might already have a successful program that addresses the mental health issues that children and youth are prescribed medications for, but that this program might have a a lengthy wait list. So in such cases, the agency could invest their resources to expand the existing program to meet the high need instead of rolling out a whole new program. And the last possible solution, which is building an evidence base for a locally developed program, is one that we provide these recommendations to, these are standard recommendations, but this one is we're a little apprehensive to promote. And the reason is when it comes to mental health, it's important that the interventions that we utilize be rigorously studied to ensure that they are effective and safe for children and youth. So this is critical as we don't want to promote mental health practices that subjectively seem beneficial but are actually ineffective or possibly doing more harm than good. But nevertheless, that could be an option for your agency. Okay, so moving on, if the decision is made to adopt a new program, your implementation team will want to identify some lists of key terms that describe the issue that you're experiencing. So for our example, just some simple key terms, including child and adolescent, externalizing problems, and aggression. So using these key terms, this is where the CEBC can be of help. So once you access our program directory, this is what you'll see. This is an image of the front page of the program directory, and you can see that there's a red arrow that's pointing to topic areas. So this is one way to access the programs that are in our registry. There are several ways. I'm going to highlight it two ways. But the basic way to go in through the topic areas is you can just go on the left-hand side, and it'll bring up our entire list of topic areas, and they're clustered within various domains. And here you can see our mental health interventions. So here they're listed, and I'll just call them out. So anxiety treatments, attachment interventions, bipolar disorder treatments, depression treatments for adults and also for children, so they're separate. And then we have disruptive behavior treatments. And then we have infant toddler mental health programs. And then we have trauma treatments for adults and trauma treatments for children. So these are the topic areas, but there is a better way to actually search for programs. So if you were to just click on, say, trauma treatments, it'll list everything that we have on there, and not necessarily everything in that topic area would be relevant or helpful for your primary issue. So what I want to do is actually go live for a couple minutes on the website and show you a more efficient way to access what it is that you're looking for. But before I do that, I had another poll question. And so this poll question I want to be able to use to kind of guide which topic areas that I'm going to show. So starting at the top, select disruptive behaviors, and that can include oppositional defiant disorder, conduct disorder, and ADHD, or issues that are similar but without the diagnosis. And so that's what the et cetera means. B would be mood disorders, for including depression and bipolar. C would be trauma treatments for children and adolescents. And D would be attachment interventions for children and adolescents. So what I'll go ahead and do is Molly will open up that poll question. And the one that gets the highest votes, I'll showcase that as the topic area. But keep in mind the steps that I follow when I go live, you can apply to a different topic area. So we'll just give a couple seconds for everyone to answer. All right, so we're going to go ahead and broadcast the results and end the poll. So it looks like trauma treatments is the number one, followed by disruptive behaviors. So if you selected disruptive behaviors, again, like I said, you can use the same step-by-step procedure that I'm about to show you for disruptive behaviors, but I'm going to do it for trauma treatments. So let's go ahead and take the poll down. And I'm going to go ahead and go live on our website. Okay, so this is, again, the front page of our website. And I'm going to access our program directory. And instead of going to topic areas, I'm going to go to Find a Program, which is down here. And there's a couple different ways that you can search. I'm going to do an advanced search. And here it brings up a couple different ways that you can filter through for what you're looking for. So as I mentioned, our scientific rating, this is why it's important to know that. So for the purposes of this example, I'm just going to select 1, 2s, and 3s. I'm going to skip the relevance level and the outcome and go to trauma treatments. And so we did just recently split the trauma treatments, and so there are trauma treatments for client level, and then we also have trauma treatments for system levels. So this is like organizational level, things like staff training. But for the purpose of this example, we're going to do trauma treatments for client level. And the last filter option is by age. And so here you can select the range that you want. So for our example, I'll do older youth, so 14 to 17. But here you can specify whether or not you want any of these ages to include. So if we keep it selected on this one, it'll have 12, 13, and 14 for any programs that include that age range because it touches in on our range. But if you just want that range, you can select all, this option down here. But for this example, I'll keep it as is and see what comes up. All right, so you can see our search result right off the bat. We got 12 programs. And so you can see there's a brief description for each program featured on the search results. If you want more information, you can click on the name of the program. But say if you're kind of just eyeballing it and you see that this one looks, you might be familiar with this one and you're interested, you can check this box here. And the more boxes that you check, it will compare those programs. So I'll check a few just randomly that fall within, that include the age range that we selected. All right, so you can, I think you can compare up to 4 programs, but I'll just stick with 3 right now. So here you can get a summary of the scientific rating. And then there's also, I'm going to skip down to, there's a brief description for the program. What are the program goals? What is the target population or any key target population demographics? So you can see 17 through 18, 5 through 17-year-olds, 2 through 17. The service details, so what does the actual program include? What's the intensity and the duration of the program? And where do you offer these services? So the delivery setting. And then going down into training details, what languages are available. You can see Spanish and Japanese, and then EMDR has quite a bit. And then the resources needed to run the program. So these are things that could be like office space, computers. What are the actual resources that you have to have in place before you start offering the program to your clients? And then the training recommendations are the minimum provider qualifications. So what are the degrees that are needed? So master's level therapists, licenses. So you can see on your screen, it's pretty much the same. And then is there a manual? This is not always the case, but in our example, it does look like there is a manual available for all three of these treatments. And then is there training available? And also yes. Okay, so that's the live example that I wanted to show. And again, you can apply this to other topic areas as well and other age ranges. But if you were, say, I'll just randomly pick eye movement EMDR. If you want more information in terms of implementation or kind of the research that supports this practice, you can scroll down. So this is the summary information that we looked at, but then there's additional information in terms of implementation information right here, and then summaries of our of the research that we looked at that we factored into the scientific rating, some references, and then also the contact information. So if you wanted to actually implement this program, or if you had a question about this program, we not always, but we try to include contact information for the developer. Okay, so that's our example. I go back to the PowerPoint. Okay. So once you've gone through the website and you've kind of narrowed down to a list of a couple programs, the next step is to determine program fit. So you'll want to look at these areas, and I'll explain what they are in just a second, for each of the programs that you identify. So you'll want to critically examine all of these domains as they relate to each prospective intervention. So first is ease of use. How complex is the program for your agency and for your clients? External compatibility is how compatible is this practice with the beliefs and the values of the local community and the clients? So is this a program that another provider in your area would actually refer to? Financial considerations and relative advantage. So that means what financial resources exist? What are the training and consultation costs? Does the practice have efficiency over what is already being done? So internal compatibility means how does this practice fit with the agency norms, the values, and the beliefs? So will it require a drastic change? Knowledge requirements, how much training is required to implement the program? So match of skill set, what education level of pre-existing skill set is required? So does this fit with the existing workforce in terms of the degrees that they already have? The observability of benefit, so are the outcomes of the program easily observable? How will the program results and outcomes be measured? So does the measurement system fit with the existing data collection system that's already in place? Reinvention and adaptability. So can the practice be adopted or modified to meet community or population needs? So will adaptation jeopardize outcomes? Risk means, is there a risk to adopting this program? And that can be either through costs, so what are the upfront costs, and how strong is the research evidence? So if you're adopting a program that doesn't have much research, what's the risk associated with implementing this program and it not actually working? Training and support. So how much training is required and how will staff be trained? Is there a training wait list already? And what training options are available for staff turnover? And then finally, trialability, which is can staff attend a training session and review the manual prior to adopting the program so you can get a sense of what it's about? And can the program start small and then be scaled up instead of just rolling it out all at once across your entire county? So if you want to access more information about each of these domains, I provided a link on the slide, which takes you to one of our resources, which provides not just concrete questions that your team can ask itself when it's looking at these domains, but also examples, real-world examples of what other areas have experienced in terms of these different domains. So the next step is for your implementation team to compare each of these domains across each program. So again, you can access resources on our website for making comparisons across each of these domains as well. All right, so back to the EPIS phase. So as I mentioned, I'm going to be touching on some of the preparation phase. So once a decision is made to adopt a new program, then the agency moves to preparation. There are several steps in preparation. However, I will only be highlighting a few that are relevant to implementing psychosocial treatments. So if you do want more thorough information on this, you can access our past webinars. So since many of the psychosocial interventions are programs that wouldn't necessarily be offered by child welfare, but by mental health agencies, I wanted to touch on important considerations for contracting for services. So first, when an agency is developing an RFP for a specific program, then they should clearly specify the program that they've selected, including all the program requirements, such as staff qualifications, fidelity monitoring, outcomes monitoring, training, planning for staff turnover, and anything else. And then also for agencies that have identified the problem but want the contractor to select the specific program. So for example, you conducted the needs assessment and determined the issue was trauma symptoms, then it is vital that you clearly define what you mean by evidence-based. You can go about this by instructing the applicant to detail the specific CABC rating level or another clearinghouse, or suggest a list of potential programs that address the issue. Okay, so I did want to touch on barriers and challenges to implementing psychosocial EBPs. So preparation is when you start to look and plan for these potential issues. So starting out, we have organizational issues, and obviously one of the biggest is upfront costs. So some programs do have significant startup costs, so it is important that agency leaders plan ahead for what is feasible to implement, and if possible, apply for additional funding sources. Right now, the CABC is currently in discussion about ways to provide information on funding strategies for programs listed in our registry. So that could potentially help providers with noting ways to bill for services and promote program sustainability. So stay tuned for that. Staff time. Agencies need to plan for how staff training time will impact their current workload and their schedule. So it may be possible to work with the program developer or the trainer to train staff in small doses in order to avoid disrupting workloads. And then staff turnover, which is very common when implementing EBPs. So it may be possible for your agency to receive a training for trainers. It depends on the program. So again, you would want to contact the program developer to look at what your options are. Staff buy-in, so among parents, psychiatrists, etc. So not everyone may be on board with your efforts to reduce psychotropic medications. So for foster parents who have been around for a while, it might be helpful to provide them with kind of a basic trauma-informed 101 type training so that they can be educated on mental health issues, the impact of medications on well-being, and the importance of understanding that behavioral change takes time. So it also may be beneficial to educate psychiatrists on your agency's efforts to reduce medications and possibly invite them to join the implementation team. And then moving to program engagement issues. So in some cases, client mental health and behavioral health issues might be so severe that they impede the ability to even initiate a psychosocial intervention. So in such cases, treatment planning would need to address this. And this may be a potential situation where short-term medication use may be needed. However, the treatment planning team would need to ensure that this is periodically reviewed and reassessed to ensure that medication use does not extend beyond what is necessary. And then the role of the foster parent in the intervention. That needs to be clearly defined in the beginning. So many behavioral management programs are parent-mediated, which require the foster parent to be the primary mechanism for delivering treatment. So in fact, in some interventions, the program model details the foster home as the primary clinical environment. It requires that the primary foster parent have a certain amount of availability. So these expectations would need to be established early on, and for foster parents to receive vital support from the organization as well. And then lastly, cultural adaptation. So cultural needs, when they conflict with the components of the program, could justify modification. So to approach this issue, providers should contact the program developer first to identify ways to make program modifications in response to cultural needs. Any type of modification to a program should be taken carefully in order to avoid jeopardizing fidelity. So the CBC also has a cultural resources section on our website, so that also includes webinars and peer-reviewed articles on this topic as well. Okay, so lastly, one of the central themes for today's webinar is the importance of proper screening and assessment. So not just for ensuring that you select the right psychosocial intervention, but also to ensure that the appropriate children and youth receive access to your newly implemented program. So we know the root clinical problem can be difficult to recognize, particularly in situations where there is a history of trauma. So programs do have specific targeted populations, so it is important to screen out those who do not meet the criteria. And then as you move through the rest of the EPIS phases, periodic reassessment and monitoring is vital for sound organizational and clinical decision-making. So your agency needs this data in order to determine if the program is truly successful. So to learn more about screening and assessment in child welfare, we did recently do a webinar on this topic as well, which you can access on our website. All right, and I also just want to let everyone know that all of our information on implementation can be accessible through our selection and implementation guide, which is free to download on our website. So it does include detailed information on every EPIS phase that I mentioned, and it does have technical assistance materials that you can download and use, especially if you have an implementation team that is looking for guidance. And it does have a lot of real-world examples, and it is written in plain language so that anyone can pick it up and understand it. You don't have to have a research background in order to understand implementation science or our guide. And then I also wanted to let folks know that even though we have this guide, we know that there's limitations to just downloading manuals. So in terms of customized, tailored assistance to your agency, we did want to let you know that we have a survey up, that if this is something that you're interested in, we would definitely like your feedback. It's a very short survey. It should only take 5 to 10 minutes to complete, and this is going to kind of help shape our future directions when it comes to assisting agencies with implementing evidence-based practices. And then another shout out to another resource that was just recently released. As I mentioned, the CEBC is operated by the Chadwick Center, and the Chadwick Center just recently entered into a partnership with Chapin Hall, which is at the University of Chicago, and we're releasing a series of briefs. And the first brief just released in January, and if you're not familiar with it, the topic is on using evidence to accelerate the safe and effective reduction of congregate care for youth involved with child welfare. And so similar to the topic that we're just talking about today with psychotropic medications, is when you're taking away something like congregate care, the question then becomes, what are you then putting in place? And so there's very detailed recommendations regarding this issue, and you can download this policy brief either off of the Chadwick Center website or the Chapin Hall website. So that's going to do it for the content. I just wanted to open it up to any questions that the audience might have. So I'll give folks a couple seconds to type anything out. So it looks like there's a response to the FDA approval procedure for medications. And so that is one of the reasons why medications aren't specifically approved for children and youth under the age of 18 is that there are issues of consent in the research being conducted on the effectiveness of these medications. And so I'm not too thoroughly familiar with the FDA approval procedures. I do know that consent is a huge barrier for medication research when it comes to minors. But yeah, that's definitely a concern when it comes to prescribing these medications when they're not necessarily tested on them, on that population. Looks like we have a response from someone that says, thanks for the links that we've provided. You're welcome. Just give a couple more seconds, folks who might be thinking of stuff or typing things. No? Okay. So yeah, I'm going to go ahead and move on. I do have just a little bit more information. Here are the references that I've cited throughout the webinar. So yeah, feel free to access these. And again, you can download the PowerPoint slides, and that way you can pull these up on your own time. And then I did have some information that I wanted to pass on in terms of staying in contact with the CEBC. We do have email alerts that we send out, which promote kind of the webinars that we periodically do, and then also the resources that we have, and then also when we launch new topic areas and add new programs to our website or new implementation resources. So I highly encourage you to sign up for our emails. And then also visit the website. And if you have any questions, you can email us at info@cbc4cw.org. And then lastly, we're on social media, so feel free to like us on Facebook and follow us on Twitter, which not only do we promote our own stuff, but we also send out great information that's in the evidence-based practice community as well. So that's going to do it for me. Thank you, everyone, and have a pleasant day.
Thank you, everybody, and make sure to look out for the email with the survey regarding this webinar and what you thought of it and how you can help us for future webinars. We would greatly appreciate it. Have a great day.